Hey everybody. So today we'll be discussing types of clinical studies, types of research studies, and how do you know which is which. Okay, so this is going to be the basic one, basic talk basically. Okay, fine. Basics here. So when you look at medical research, there is a primary medical research and there is a secondary medical research. So secondary medical research naka, you take everything that is done in primary and you put out another result. Okay, so these many studies have been done in the same topic and I am putting everything together and I am giving you a consolidated report. Okay, so that is secondary research. Primary research naka, you are doing something from scratch. Okay, so it can be a basic lab level research or it can be a clinico-epidemiological research. Lab level, it is more of cellular study, tissue level study, animal study, genetics, genomics. This will come under lab level study. Clinico-epidemiological naka, so it can be observational, interventional. Okay, so how do you classify this clinico-epidemiological study? So there are two kingdoms to this. So one is experimental, the other one is observational. How do you decide whether it is experimental or observational? It is completely based upon whether exposure has been assigned or not. When exposure is assigned by the investigator, it becomes experimental. Okay, when it is not assigned, it becomes observational. Okay, so if it is investigator is assigning the exposure, it becomes experimental. And then they are doing random allocation of subjects. You go there, you go there, you go there, you go there by a specific method, then it becomes a randomized control trial. When you don't have any idea how to divide, you tell, these many numbers you go here, these many numbers you go here, one person is left out, you go here. You have no rhyme or reason how you are dividing. Then it becomes a non-randomized control trial. But it's just that you have assigned exposure. When you don't have any exposure which is assigned, okay, that becomes an observational study. Okay, and whether you have a comparison group or not will be the next question to ask. If you do not have a comparison group, then it becomes a descriptive study. Okay, when you have a comparison group, it becomes an analytical study. All right, so which direction is this analytical study going? Is it going from outcome to exposure or exposure to outcome, or both are there at the same time? You are just studying the population at a point in time. Okay, so if it is going from exposure to outcome, okay, from A to Z, if it is going, that's a cohort study or a prospective study. You are prospectively studying the population. When the study direction moves from outcome to exposure, then that becomes case control study. Okay, outcome has already happened. You're going back in time to see what caused this outcome. Okay, so that's case control or a retrospective study. Okay, both has already happened. Now you are trying to study at that point in time. Okay, so these many people are having same beautiful faces or acne faces, and you are trying to see what are all the products that they are using. Okay, so all of this you are doing at that one point in time, correct? Say now at 5 o'clock in the evening on so on Sunday on so and so date, you are taking this whole population and you are checking. So exposure is already there, outcome is already there, and then you are saying, okay, what has happened, who has used what? That becomes a cross-sectional study. Okay, so again, cohort study means exposure has happened and then you are following them up for outcome. Say you are using some particular shampoo, you are giving everybody to use one particular type of shampoo and you are following them up over a period of time to see what is happening to the outcome. And you are comparing it with another group where you have not given this nice beautiful haircut shampoo. Okay, so that is cohort. Prospectively, you are going and seeing whether they are having nice silky hair like this. Case control study is ulta. Okay, you are having people with all frizzy hair all over the place. Then you are asking them, okay, yesterday what did you use? Last week what did you use? Last year what did you use? Trying to see which exposure has made them have this frizzy hair. That is case control or your retrospective study. Okay, when both has happened at the same, both has happened already and you're studying that population at that particular point in time, that becomes a cross-sectional study. Okay, so let us look at descriptive study. So throughout the presentation, I will try to use the same classification so that you are able to understand what we are talking about. Okay, so descriptive study is the first step in research where you are just describing a natural history of a disease. Okay, so there are no control groups here. See, there is no comparison group. Okay. And did somebody assign exposure? No, nobody has assigned any exposure. Okay. So this example of this would be trying to tell the natural course of enteric fever, natural course of malaria, natural course of whatever disease that you want to take. So that will be descriptive study. You are just describing the course of event as is without trying to intervene anything anywhere. Okay, so here there are no comparison control group, and here there are no exposure that are specifically assigned by the investigator. Okay, so exposure can be a intervention. Okay, imagine it like that. What about cross-sectional study? Cross-sectional study, they are basically analytical studies. Okay, so you have no direction in this at a particular point in time. You are studying. Okay, so it examines the relationship between outcome and exposure in a population at a defined point in time. Okay, advantage is that it is cheap, simple. You go on a street, ask everybody what has happened, and you are done. Correct. There is not much of money involved. There is not much of time involved. It's ethically safe, and you can measure prevalence. Okay, so you can tell, okay, so these many people are having acne on their faces at this point in time, but you cannot tell incidence. Okay, so prevalence is what is there. Incidence is how many are happening. Okay, so if you want to know how many are happening, then you need to see over a period of time to the future. Okay, so into the future and beyond. It's like that. So only in a prospective thing you will be able to talk about incidence. Okay, so you cannot talk about incidence in a point assessment. Disadvantage, it establishes association most of the time, but you can't tell specifically this is what has caused it. Okay, so maybe there is an association with this cream and this acne, but you can't specifically tell this is what has caused the acne. Okay, recall bias may be there because you are just asking them at that point in time, you tell me what are all the things you are using, what are all the things you have used before. And confounders may be there and they may be unequally distributed. All right, and group sizes might be unequal, especially if you are comparing first street and second street, and you want to see whether these people have used that, those people have not used that, then that may not work. Correct? Because say water supply is different for one street and another street. That is why they are not having acne, these people are having acne, and that point gets missed in your assessment. You will never know. Next is cohort study. Cohort study is a type of analytical study and you have a comparison group to it. Okay, so cohort, it's data obtained from groups who have been exposed already. Okay, yeah. So this is where you are giving shampoo to get the silky hair. All right. So you are already giving them exposure and you are following them up over a period of time to see if they are actually having silky hair. Okay, the other group does not have that shampoo, and you are also following them over a period of time to see if they still end up having silky hair. If they are also having silky hair, special shampoo is also having silky hair, then there is no difference between the two products. Correct? So that is cohort study. All right. So this is best for trying to tell, okay, this has caused this. It is ethically safe. Okay, so you definitely need to have a how to tell, ethical clearance before doing these sort of studies, any interventional study for that matter. Subjects can be matched. You definitely know this is the exposure that you are going to introduce because you are controlling variable other factors. Okay, and it is cheaper than RCT, but it is costlier than a case control study because this is going to happen for a long period of time. Disadvantage, you may not be able to get adequate controls. People may not be willing to participate in the study. Okay, and exposure may be linked to a hidden confounder. You never know that. You will not be able to blind people in this. You are giving a pink color shampoo to one blue color shampoo, and people will know they are different shampoos. And for rare diseases where it may or may not happen at all in your lifetime, you can't follow them up for 50 years, 60 years to see if at all it is going to happen. Okay, so advantage is that it is good. Subjects can be matched. You have an exposure to outcome and you will be able to give a number in terms of, say, incidence. It's cheaper than RCT. Disadvantage, it is costlier than case control. You have to follow them over a period of longer time. Okay, and you may not be able to get properly matched controls. Blinding may not happen because randomization again may not happen. And for rare diseases, this is not the study of choice. Next, case control study. Case control study is the reverse of your cohort, where outcome has already happened and you are tracing back in time to see if any exposure can be associated with the outcome. Okay, the advantage is that it is quick, it is cheap. For rare disorders and all, you will be able to do a case control study, and you may not need too many population like that of a cross-sectional study. Okay, so you can have a specific number with which you will be able to get a reliable outcome. Disadvantage, it is completely dependent on patient's recall capabilities. So they may or may not remember if something has or has not happened. Lot of confounders are there. And again, selection of control groups will be difficult. Next comes your non-randomized control trial. So this is an experimental study. It's just that randomization has not happened. Okay. These are stronger than any observational studies, less stronger than your randomized control trial, because in this randomization has not happened. Here, exposure has been assigned, just that there is no true randomization. It will be very similar to that of a cohort study. Randomized control trial, the investigator has assigned exposure and there is a random allocation by a specific method. What are all the methods in later classes we will see. Advantage is that you will be able to study the effect of an intervention in a controlled environment where one group is definitely exposed, one group is definitely not exposed. The chances of confounders are less compared to other studies. You will be able to do blinding where one person does not know whether they are receiving the intervention or not. And statistical analysis, you will get stronger values. Disadvantage is that it's expensive, time consuming, and you need to have people who are ready to take up the study and do the study. And sometimes it can be ethically problematic. So what is this blinding that we are talking about? Blinding is something that is important for reducing bias. But what is it? It is just that a particular population does not know the intervention. Okay, so when you tell single blind study, the participants do not know what sort of intervention they are receiving. When you tell double blind study, participants also don't know. Whoever is conducting the experiment also do not know, because everything comes in a sealed packet. Triple blind study, participants also don't know. The experimenting people also don't know. Researchers also don't know. Whoever is sitting at the headmost, only those people know A is equal to this drug, B is equal to this drug, and C is equal to this drug. Okay, so analysis will come out as A is better than B is better than C, and only people at the top will know what is A, what is B, and what is C. So that is triple blinding. Okay, so why are we having so many sort of studies? Because earlier days it was more starting out as case reports and case series, and slowly we have evolved over a period of time to tighten up the process to get more reliable results rather than having hearsay. So that is why this levels of evidence pyramid. Okay, so where your case reports, case series, expert opinion, that person told, this person told, and all is at the bottom of the pyramid. As you ascend up your case control, then comes your cohort, then randomized control trial, then systematic review and meta-analysis. Systematic review, meta-analysis and all, they are all secondary researches. Okay, remember that. So the higher the pyramid you go, the better is your level of evidence. More reliable would be the results of the study or analysis of the study, which can be applicable in your population. Okay, and in these studies, you use various statistical terms, rates, proportions, ratios. I just thought I will touch upon the topic. Ratio naka, whatever number you are having, the numerator part will not be there in the denominator. Example will be maternal mortality ratio. When somebody is using the term proportion, denominator will have numerator also as part. Okay, so numerator by numerator plus denominator it will be. Okay, and there won't be a time component in terms of proportion. When you tell rate, rate also includes time. It is similar to proportion, it's just that it includes time. Prevalence and incidence will be the typical examples. Okay, prevalence naka, in this population, I am seeing 10% of the people who are affected by tuberculosis. So that's proportion, your prevalence. Okay, yeah. What is it? What do you want? I am going to class. Okay, so rate means incidence. So when you tell incidence rate, naka, you see over a period of time how many people are having what. So ratio, is the numerator included in denominator or not? Yes. Is the time included in denominator? Yes, then that becomes rate. If time is not included, then it becomes proportion. If numerator is not at all included in the denominator, then it becomes ratio. These measures of association we have already seen. Okay. Thank you. Bye bye. Bye. Bye.